Tēnā koutou katoa, ko Beatrice tōku ingoa. Hello everyone, I'm Beatrice. Thank you Deborah for the introduction and thank you for choosing to attend this session. So we will be talking about blood cancers in the mouth today, and I am a special care dental specialist, also known as a special needs dental specialist. I provide dental services in both public and private sectors under Tauranga Special Care Dentistry and Te Whatu Ora Health New Zealand. So I will keep information as broad as possible in view that we have a range of audiences today, and we will go through some information on blood cancers, signs and symptoms, cancer treatment and its oral side effects, what optimal oral health is and some useful products, with a little disclaimer that I'm not sponsored by any companies, in our sessions with Q&A. So as a part of my introduction, I'd like to greet you all in my language, Salam Sejahtera and Tatia Hau. So I'm originally from Sarawak, which is on the island of Borneo, the largest state of Malaysia. And Malaysia itself has 13 states and 3 federal territories with a population of 34.5 million people. Now, when comparing our landmass, we are fairly comparison in size. New Zealand is about 1.2 times smaller than Malaysia. So what are we famous for? Sarawak itself has a population of more than 2.6 million, and Sarawak can look like this and this. So what are we famous for? We are a cultural hotpot. So there are some 27 ethnicities in Sarawak itself. About 30% are indigenous, who are Dayaks. About 25% are Chinese, and the rest are orangutans. Sarawak is also famous for its wild rainforests and many delicacies. Now, special care dentistry, also known as special needs dentistry, is a branch of dental specialty that provides comprehensive oral health care for individuals with intellectual disability or cognitive impairment, physical disability, mental health or psychiatric problems, and also those with complex medical problems. This often covers a range of patients, from transplant patients to cancer patients to autoimmune conditions to end-of-life care. Often, special needs dentistry also includes individuals with severe dental phobia, requiring some extra tender loving care. Now, I'd like to know a little bit about you. Who is from the North Island? Oh, a majority. And so I guess nobody's from the South Island. You are from the South Island. Okay. How many have just been diagnosed with blood cancer? Okay. I'm going through treatment and completed treatment. How many have been diagnosed with myeloma and lymphoma, leukemia, myelodysplastic neoplasms, myeloproliferative neoplasms. Okay. And how are you this morning? Okay. Time to get a little bit more serious. Blood cancer symptoms can vary on the type of blood. Blood cancer symptoms can vary on the type of blood cancer. So some symptoms are unexplained weight loss due to altered metabolism and reduced muscle and fat, unexplained bruising or bleeding due to low platelets, lumps or swelling due to abnormal white blood cell buildup in lymph glands, unexplained drenching night sweats or rash and itchy skin, repeat or severe infections and regular fever due to poor immunity, pain in your bone, joints and abdomen due to damage to the bone and abnormal blood cells building up in the spleen, fatigue, unusually pale complexion and shortness of breath due to low hemoglobin, which is anemia. And mainly in acute myeloid leukemia, the first clinical manifestation can be oral signs. It could affect your gums, your jawbone, your roof of the mouth, the inside of the cheeks. One could have ulcers, gum bleeding, bruising, bluish or pale oral tissues, swollen gums, and areas of tissue dying. And mainly in myeloma, there could be bone damage and pain, leading to further dental problems and swelling. And when our immune system is suppressed, microorganisms that are already present in our body can grow out of control and cause problems such as infection or thrush. Now, most people are aware that the common side effects of cancer treatment are nausea and hair loss. Did you know that 1/3 of the patients who undergo cancer treatment develop complications that affects the mouth? Many cancer treatment, including chemotherapy and radiation, can affect an individual's dental and oral health. Oral complications can make it difficult to eat, talk, chew, and swallow, and these can affect a patient's health and quality of life. They can even affect a patient's ability to complete a treatment. So in some cases, when oral complications are severe, the effects of cancer treatment can be significant. For example, treatment doses may need to be lowered, treatment schedules may need to be changed, treatment may be delayed or stopped altogether. Oral complications occur in nearly 40% of those who receive chemotherapy, and approximately 80% of those who have a stem cell transplant, and nearly in all patients who receive radiation to the head and neck region. The severity of the side effects depends on the individual and also on the cancer treatment itself. Now, chemotherapy drugs slow and stop the growth of fast-growing cells such as cancer cells. They may also harm normal, healthy, fast-growing cells such as cells in our mouth or our hair follicles. As chemotherapy can prevent the growth of normal cells in the lining of our mouth, this can affect the ability of the oral tissues to repair itself, which results in mouth sores or ulceration. And when the redness in the ulceration affects a large part of your mouth, it is termed mucositis. Now, mouth sores can also happen in the throat, which can cause difficulty swallowing and pain everywhere, which can be severely debilitating. And with all of that combined, missing out. Chemotherapy can also alter your taste, and with all of that combined, some may end up with malnutrition and dehydration. Chemotherapy can also cause a decrease in the number of white blood cells, and as you all know, white blood cells fight infection. And with low immunity, it is difficult for our body to fight off bacterial, viral, and fungal infection. There are many kinds of microorganisms that are in our mouth. Some are helpful, some are harmful, and when in good health, the good microorganisms keep the bad ones in check. And chemotherapy can disrupt the healthy balance of oral microbiome in our mouth. In other words, disrupt the healthy balance of the community of microorganisms that exist in the oral cavity, and this increases the risk of clinically significant infection during cancer therapy, such as oral fungal infection, as previously mentioned. And when you have ulcers, there is damage to the lining in the mouth, and infections that start in the mouth can then spread through the bloodstream and affect cells in other parts of the body. Now, additionally, one may also suffer from dry mouth, which further adds to increased risk of oral health problems. And another side effect of chemotherapy on the bone marrow is that it can decrease the number of platelets in your blood and may contribute to bleeding in the mouth. Chemotherapy can also cause adverse functional and structural change in your nervous system, and in children affect their growth and development. Now, you may think how radiotherapy in the head and neck region is relevant to blood cancer, which is true most of the time, but I will touch on this with a case example at the end of my presentation. If you do receive radiation in the head and neck region, its oral side effects is fairly similar to chemotherapy. Radiation therapy can, however, directly damage your oral tissues, your salivary glands, and your jawbone. Areas treated by radiotherapy can scar or waste away. And while radiotherapy can cause short-term complications, it can also cause permanent tissue damage that puts a patient at risk for lifelong oral complications. Now, I'd like to highlight that the breakdown of tissues and muscles would make it difficult for a patient to open their mouth, and the breakdown of bone can cause non-healing jawbone problems termed osteoradionecrosis. Chemotherapy, when combined with radiotherapy, can make some side effects worse. This is, however, likely less relevant for most of you here. Now, the high doses of chemotherapy typically used before a stem cell transplant may cause dental and oral side effects, as we have discussed, and patients who receive allogenic stem cell transplant have an increased risk of graft versus host disease, GVHD. GVHD occurs when the transplanted donor cells attack the patient's body. Acute GVHD usually develops within the first 100 days after transplantation, and it primarily affects the skin, liver, and the GI system. Some may be mild, and some can be severe or life-threatening. Chronic GVHD occurs months to years after your transplant, when you may no longer have weekly appointments with your transplant team. It may involve a single organ or possibly many organs, and symptoms can also range from mild to life-threatening. It is important to examine your body, in particular to your eyes, your mouth, your skin, your joints, and the genitals for symptoms of chronic GVHD. If you do have symptoms, call your doctor immediately. Although a symptom may be caused by anything other than chronic GVHD, your doctor needs to evaluate it. Early detection and treatment may help to limit the severity of the disease. Symptoms of oral GVHD may include painful mouth sores extending down the throat, extreme dryness of the mouth, increased sensitivity and pain to spices, alcohol, cold, hot, acidic, spicy food and drinks, difficulty in eating, change in taste, and a tightness or limitation in mouth opening. And while some cases can be managed with topical therapies, management may also require long-term immunosuppressives and/or steroidal drugs, with further associated risk of local and systemic infection, kidney problems, high blood sugar, bone problems, and potentially secondary cancer. Now, moving on from all of that difficult topics to some lighter stuff. So what is a healthy mouth? A healthy mouth means you can perform essential functions such as eating and drinking, breathing, speaking, and smiling without any pain or discomfort. A healthy mouth should enhance your quality of life, and having a healthy mouth also prevents tooth loss and infection that could lead to systemic infection. Your oral health is integral to your general health. If you are not too lethargic, I'll advise for twice daily toothbrushing. If you can't find the energy and the motivation to do so, do once a day nighttime brushing before bed. Your mouth doesn't produce as much saliva when you go to sleep, hence this makes your mouth a great place for bacteria to breed overnight. So when you brush at bedtime, you remove a lot of the bacteria and the food and drinks that we've had all day. It is good to brush twice daily because it breaks the growth cycle of the bacteria. And bacteria uses the sugar and the starch in the food and drinks that we take to produce acid and causes decay. Plaque, when not brushed away for a couple of days, hardened into tartar, can also irritate your gums and cause gum disease. I understand and respect that some are not agreeable to fluoride use. Fluoride is a naturally occurring element in earth, and because of that, it is also found naturally in plenty of things that we eat and drink every day due to the uptake from soil during cultivation, such as a cup of brewed tea and coffee. Dentists believe in fluoride, and this has been proven over many decades that a good amount of fluoride makes the teeth more resistant to decay. Fluoride also interferes with the growth of bacteria and helps repair the early stages of tooth decay. Most toothpaste have 1,000 parts per million of fluoride, and prescription-only high fluoride toothpaste have 5 times more fluoride than the regular ones. They are helpful for those with higher decay risk. After toothbrushing, please spit clean and don't rinse. Fluoride that helps your teeth the most when it is applied directly to your teeth, and fluoride that stays on your teeth provides the greatest benefit. Here are some other products that you may consider if normal toothpaste irritates the mouth. They are SLS-free, sodium lauryl sulfate-free, and foams lesser. Some find it more comfortable to use, especially when you have mouth sores or dysphagia. If all fails, you can still brush with a solution of 1 teaspoon of salt plus 1 teaspoon of baking soda in 1 cup of water. High fluoride toothpaste are useful for people with high decay risk, and you will only require a pea size, and remember to spit only, no rinsing. Now, some of you may like to know, what about toothbrushing and flossing when your platelets are low and you're very bleedy? Well, there is no best approach to this, and our pool of specialists believes that proper toothbrushing and flossing outweighs the risk. As healthy gums don't bleed, stopping routine oral hygiene can promote further gum bleeding and increase your risk of infection. However, if you are severely thrombocytopenic, perhaps consider not flossing and continue routine toothbrushing with an ultra-soft toothbrush. You may also consider seeing a dietitian to ensure you pick the right food choices that are good for your teeth and your general health. Here are some examples of toothbrushes, flosses, and interdental brushes that help you to clean in between your teeth. Interdental brushes come in different sizes to fit different gaps, and they are best for you when you have wider gaps between your teeth where floss cannot effectively remove debris. Interdental brushes are also helpful for those with dental bridges, crowns, implants, braces, or retainers. The first step to interdental brushing is to choose a brush that easily fits the spaces between your teeth. This may mean using different size interdental brush for different areas of your mouth. And you hold the brush between your thumb and your index finger and insert it gently between your teeth with a light back and forth movement, approximately 2 to 3 times in each gap. If your brush gets stuck, you may need a smaller brush. These brushes have bristles that can be bent to make cleaning easier. And when cleaning between the molars, it may be helpful to clean from both the inside and the outside. Use your interdental brushes at least once a day before your usual brushing and focus on the hard-to-reach areas, and then continue your usual routine toothbrushing with a soft toothbrush. Interdental brushes are reusable, so wash the brushes and put the caps on when you have finished, just as you would for a toothbrush, and you can change the brush when the filaments are worn, just as you would for a toothbrush as well. Using a dental floss will be more technical compared to an interdental brush. So you take about 45 centimeters of your floss thread and wrap it around your middle finger and hold it tight with your thumb and index finger. Now you keep your thumb and your index finger closed tightly and then aim to thread it gently between your teeth. Be careful not to hurt the gums with movements that are too hard. Gently move up and down in one tooth, slightly below the neck of the tooth which is covered by the gums, and then back up again to the other side. Now, some may find this slide funny, but toothbrushing is one of those things you never really ponder about and would probably be too shy to ask anyone about it. So firstly, lubricate your toothbrush with a small amount of water and only use a pea-sized amount of toothpaste. You insert your toothbrush at a 45-degree angle to your gums and use gentle, circular strokes to brush your teeth. I like to do it from the top right to the top left and then from the bottom left to the bottom right. I then return the brush to the insides of my teeth from the top right to the top left, from the bottom left to the bottom right. So to clean the insides of your front teeth, you tilt your toothbrush vertically and use small up and down strokes. And not forgetting to also brush the chewing surfaces of your teeth and your tongue to get rid of plaque as well. You then spit the remnants of the toothpaste with no rinsing. Your dentist will have no access to your medical records, so please do bring your updated list of medications, your updated medical history, and also your blood results. It is good to sort out your dental treatment before and after your chemotherapy. Avoid elective dental treatment wherever possible during chemotherapy or cancer therapy, as you will be naked, bleedy, and immunocompromised. Chemotherapy can cause some blood changes, and certain dental procedures may warrant a platelet transfusion or an antibiotic cover. And if you do require some dental work during your chemotherapy, we will be liaising closely with your hematologist. So for mild ulcerations, you can consider these topical anesthetic products for pain relief, and it is good to apply the paste and the gel with a clean cotton bud or a glove finger. Do continue toothbrushing if you can. Consider using a soft or an ultra soft toothbrush. For severe ulcerations, consider using numbing mouthwashes to numb most of your oral tissues. Continue gentle oral hygiene practices if possible. An ultra soft toothbrush would be great here. If brushing is impossible, consider rinsing with saline or prescribed mouthwashes. Avoid irritants such as alcohol-based mouthwashes or hot and spicy food. You may also consider the dietitian for nutritional support and hydration. Here are some examples of the numbing mouthwashes. So generally you use 15 ml of mouth rinse for every 2 to 3 hours as necessary. Hold the solution in your mouth for about 30 seconds and you spit clean. The flame and capicaine are not to be swallowed. Mucosoothe can, however, be swallowed if the numbing of the throat or the upper gastrointestinal tract is needed. You are advised not to eat or drink within 60 minutes of using Mucosoothe because you may swallow the wrong way or bend or bite your mouth. Mucosoothe can also be given to children under 12s and under 3s at a lower dose with no more than 4 doses in 24-hour period. The flame and capicaine are, however, not for children below 6 years old. Cefazole mouthwash is a solution that resembles human saliva and is intended to replace the normal ionic and pH balance in your mouth. Savicol mouthwash is an antiseptic mouthwash. An alcohol-free one would be less irritating for your oral tissues, especially when you have ulcers. Regular dental checkups are always good, so keep calm and love your dentist. Now, do your best to maintain optimal oral hygiene and avoid irritants as we have discussed, and ensure you speak to your cancer team if you do notice any signs of infection. They will prescribe antifungal and antiviral medications accordingly. And if there are any concerns out of the cancer team's scope, they will always liaise with the hospital dental team. Now, do many of you have dry mouth? The dryness may get a little better after several months, but on the whole, the effects are lifelong. And saliva keeps our mouth and teeth healthy, so dry mouth management is very important. Have sips of water throughout the day and stimulate your saliva production with sugar-free gums, lollies or mints or ice chips. Consider using lip balm or a humidifier when you sleep. Dry mouth products, which I will talk about in a little while. Avoid caffeine, tobacco, and alcohol because they are dehydrating. And again, regular dental checkups are always good. Dry mouth products. Did you use any dry mouth products to help you at all? Water, yeah. Water seems to be the best solution for most people, and dry mouth products are ones that you actually need to try out and find out what suits you. There is not one product in the market that's ideal for all my patients, and these are by far the best reviewed products by my patients. There are many other dry mouth products in the market, so you can just Google search them and try out what suits you and what not. And as previously mentioned, you will be at a higher risk for decay if you have dry mouth. And on top of high fluoride toothpaste use, here are some other products that you can consider. A tooth mousse do not replace the function of a fluoride toothpaste, and it should be applied after toothbrushing. The abrasives in the toothpaste plays an important role in teeth cleaning. So tooth mousse contains recaldent, which is a milk protein that helps to repair and strengthen your teeth in the form of replenishing the lost calcium and phosphate to the tooth structure. There is also a form of recaldent in chewing gum, and chewing 4 tablets of recaldent gum during the day is also helpful. There are nowadays with many new technologies, including a water flosser and an air flosser to clean between your teeth as well. So if you want to wear plates or dentures, if you do wear plates or dentures, do rinse your mouth and dentures after every meal. And brush your dentures at least once a day with a denture cleaner or a mild soap. When not worn, keep your dentures moist in a denture cleaning solution or store it dry in a cool place. Taste changes. Chemotherapy and radiotherapy to the head and neck region can cause temporary taste changes as well, but please avoid compensating for taste loss by consuming more sweet food and drinks. Sugar is very addictive. It stimulates our brain's reward center to provide pleasure, and our self-control is often no match for sugar's strength. Sugar is everywhere, so read your food labels carefully. There are at least 61 different names for sugar on food labels. And what better way to reduce the sugar intake by reducing the whole farnel sugar intake? So challenge everyone to eliminate sugar in their diet for a month, and you will find that you need very little sugar to reach satisfaction. Also experiment with different flavors and texture, consult the nutritionist for a diet modification, and maintaining a good oral hygiene will also enhance your taste perception. Smoking contributes to general health problems, as we all know. Cancer, oral cancer, gum disease. It also causes loss of taste, stained teeth, mouth sores, and bad breath. Vaping is not a healthier option than smoking cigarettes. It isn't harmless, and the serious consequences of vaping are just starting to emerge. In other words, many of the long-term harms of vaping are still unknown. Most vapes contain nicotine, making them highly addictive, and the concentration of nicotine in vape juices can vary significantly, and some users may actually end up consuming higher doses of nicotine than they would from a traditional cigarette. Evidences show that teenagers who vapes are 10 times more likely to eventually pick up cigarette smoking, and anyone who vapes are 3 times more likely to take up smoking cigarettes. The vaping industry has been less regulated than the tobacco industry, which means the quality and the safety of the products can vary significantly. The chemicals in vape juices are now linked to cancer, asthma, wheezing, and shortness of breath, and high levels of exposure to diacetyl, which is used to flavor vapes, has also been linked to serious lung disease. Alcohol is great for celebrations, however, not the best for our teeth and our body. Alcohol is acidic, dehydrating, and high in sugar content. And last but not least, I'd like to briefly touch on a rare but serious complication where the bone cells in the jawbone dies and pokes through the gums. Osteonecrosis is the medical term for bone death. Osteo means bone and necrosis means death. So although it is generally triggered by a dental procedure that involves bone manipulation or trauma to the jawbone, it can appear spontaneously. Medication-related osteonecrosis of the jaw can affect individuals who receive medications that help with bone loss and bone pain caused by metastatic cancer, such in the case of myeloma. Bone strengthening medications only poses a risk of less than 7% of this complication, so it is important for you to take your bone strengthening medications as indicated for your overall quality of life. Bone strengthening medications affect your natural bone metabolism, including your jawbone, so that the way your bone renews and repairs itself will be different and slower compared to someone who hasn't received bone strengthening medications. Hence, it is essential for you to have a dental evaluation and treatment before you start your cancer therapy. And also maintain regular dental checkups and preventive care to avoid infection and needing extractions down the road. If you ever require extractions in the future, please inform your dentist and also your blood cancer team so that we can facilitate your care accordingly. Now, closing up with a rare case of lymphoma diagnosed on biopsy following the suspicion of an infected wisdom tooth socket. This is where I tie up the rare relevance of radiotherapy to blood cancer. Patient presented to a dental clinic suspecting an infected wisdom tooth socket. However, things looked suspicious and a biopsy was done. Patient was unfortunately diagnosed with lymphoma, but fortunately diagnosed with lymphoma then to receive timely care. The lymphatic system is a part of our immune system, and the lymphatic vessels are found everywhere in our body, including the head and neck region. And because of lymphoma involving the jaw, my patient underwent chemoradiotherapy involving the head and neck region. Radiation therapy to the head and neck region can destroy the blood vessels that carry the blood to the jawbone in the field of radiation, and a lack of blood leads to bone death. So more than a year after remission, my patient unfortunately showed up with pain in the jaw. And so this is a rare case example of spontaneous osteoradionecrosis, bone death due to radiation in the head and neck region in a case of lymphoma, blood cancer. So thank you very much for your attention, and thank you all for coming. I really enjoyed speaking to you today, and I hope this session has been useful. Happy to take any questions. Thank you.